Hi, my name is Dr. Nima Mehran, and I'm an orthopedic surgeon in Southern California. When a patient tears their ACL, one of the most important discussions we have is which graft to use to reconstruct their torn ACL. The first thing we do is decide between autograft, their own tissue, and allograft, a cadaver tissue. In my patients who are younger, such as those under 25 or even 30, and those who are high-level athletes, such as high school, college, or professional level athletes, the decision is easy. I tend to want to use their own tissue. Using their own tissue has a 5 times lower likelihood of re-tearing compared to using that of a cadaver. Patients over 40 or patients who are very low demand athletes, using a cadaver tissue can be a very good option. However, in patients who are over 40, whether you use allograft, the cadaver donor tissue, or autograft, their own tissue, the rates of re-tear have been shown to be almost similar. The most common option in high-level athletes currently in the United States is patellar tendon. The patellar tendon is taken from the front of the knee and has bone on both ends from the kneecap and from the shin bone. So when placing that in the old location of the ACL, the bone can heal within the bone tunnels that we create, allowing for more reliable construct. However, these patients can have more pain in the front of their knee since that's where they kneel and that's where we take the graft. Hamstring tendon has also been shown to be an excellent graft choice for an ACL reconstruction. In both European and American studies, there has been excellent 10 to 15 year outcomes on hamstring tendon as an ACL graft choice. Now, the difference between patellar tendon and hamstring tendon is that with the hamstring, you don't get that pain in the front of your knee. However, there is a slightly higher chance of ACL failure when compared to patellar tendon, but in most studies, the difference is very small. So what's the take-home message here? The take-home message is if you're a young athlete, if you're under 25 or maybe even 30, if you're playing high-level sports and you're putting a lot of stress on your body, playing high-level high school or collegiate or professional sports, or even really intense high-level recreational sports multiple times a week, using your own tissue is probably a better option. However, if you are an older athlete, if you're in your 40s or you're doing lower demand sports and play recreational sports occasionally, using a cadaver tissue can be a better option because the recovery can be slightly easier and there's less pain since we don't have to take your own tissue from another part of your body. The bottom line is, when having your ACL done, make sure to go to a surgeon who does many ACL reconstructions a year and discuss which grafts they feel most comfortable using. All 3 graft choices are good graft options. However, you have to determine what fits you best in your lifestyle. And more importantly, what your surgeon feels most comfortable with. For you to have the best outcome, your surgeon has to know you and your lifestyle, and you have to know what they are most technically comfortable with.